I'm Sabahat Wasti. I'm consultant in physical medicine and rehabilitation, currently serving as medical director for rehabilitation at Cambridge Medical and Rehabilitation Centre. My job entails looking after individuals with all kind of ailments or impairments that have a possible potential to render individual disabled. And we take a fair bit of delight in getting these individuals overcome their impairments or the shortcomings and bring them back into the fore of life, if you may, with the full as much of participation as possible with the given impairments. Our desire is to bring most folks back into full participation.
Thank you, Dr. Wasti. There seems to be a high demand for rehabilitation services in the region. Can you share with us an overview of the current situation of rehabilitation services offered in the region, as well as challenges that they face?
In the last decade or so, the rehabilitation has increased in both in its capacity to offer the better outcomes for patients, and the demand consequently has grown right across not just this region but globally. Rehabilitation, whereby it was considered a specialty before, where patients were brought into it or was thought to benefit at the tail end of their trauma or disease recovery period. We are now beginning to pick patients up much earlier, and the scope of rehabilitation has widened from ICU care to community. So the continuum of rehabilitation takes a patient through right from the point of the intensive care status through to the community. As such, the demand has to grow, and as it has grown globally, the same trend is being seen regionally. We have come from being a one or two specialty centers for rehabilitation some 5 to 7 years ago. Several more centers have actually come into being with both inpatient and outpatient facilities. We're taking care of patients with stroke, with traumatic brain injury, with spinal cord injury, with chronic pain, with back problems, after orthopedic surgeries, after multi-trauma. And if you see the scope of or the spectrum of these patients, is definitely the numbers have grown and the demand has grown. The region is actually evolving very well in terms of developing the facilities. We have 2 large facilities that have come up in private sector in Abu Dhabi, and there is at least 1 service in Dubai that has actually begun to take shape as well. Whereas there some 6 to 7 years ago there was 1 or 2 rehabilitation specialists, or 3 at the best. In the United Arab Emirates, we are now closing up to 20 rehabilitation specialists. A larger number of physical therapists are working, larger number of speech and therapy therapists, speech and language pathologists are working, occupational therapists are working. So all along the services have expanded, and also the expertise base has expanded, as has the patient base. The challenge that we have, though, is to have the right kind of people working in the service. We do not have homegrown talent, for instance, for physical rehabilitation medicine physicians or occupational therapists or speech and language pathologists. That's where our shortcoming is. We are still reliant a lot upon importing the talent from overseas, which is obviously a much more transit kind of talent. People come, and the continuity of the service development is hampered or hindered by people coming in, doing some work for 2 or 3 years and then leaving. What would be great is to have the homegrown talent in all areas of rehabilitation, the physicians, OT, speech, physical therapists we are producing. But then the second challenge would come in specialization of these people who are trained to do provide generic rehab or generic therapies into more neurorehabilitation, pediatric rehabilitation, musculoskeletal rehabilitation, and so on and so forth. But I'm very confident the way the specialty is developing, the way the services are developing, we are going in the right direction, and the challenges we face today will only strengthen our resolve to continually provide better and better services to the patients who need it.
Okay. Dr. White, you're speaking at the MENA Physical Medicine and Rehabilitation Congress taking place in Dubai from the 13th to 15th October, where you talk about rehabilitation for traumatic brain injuries. What important highlights can the audience expect to take away after listening to your presentation?
Right. So traumatic brain injury recovery is a very complex process. It is a common problem, unfortunately, due to road traffic accident, industrial accidents, building site accidents, falls, and a lot of patients we receive from the neurosurgical units or ICUs after traumatic brain injury have received their acute care, but not so much as getting the right kind of environment to recover in the initial phases, even after the traumatic brain injury. So the message that I will have both for the acute care teams and the long-term care teams is that the continuum of care that a patient requires after sustaining a traumatic brain injury requires rehabilitation at each stage. And I hope that people will begin to understand that patients have memory issues after even a very simple knock on the head. There is nothing that can be termed as a mild traumatic brain injury. All brain injuries have to be very carefully assessed for their effect, that the recovery period can be quite protracted and can be quite prolonged, and the patients should not be rushed back into life without appropriate assessments, because they might have concentration problems, they might have behavioral issues, which can cause a lot of problem within the family setup, at work, or within the social networking. So hopefully the overall message would be to take a wholesome care of the person who has had a traumatic brain injury, not just about their physical recovery, but also about their cognitive recovery, about their emotional readjustments, and also about the readjustments to life after such a sort of dire event. Hopefully that message will filter through my talk.
Okay. Why do you think the MENA Physical Medicine and Rehabilitation Congress is an important platform for experts of physical medicine to meet and gather?
Well, look, all academic activity is essential for development of all specialties. I'm very delighted to see that more and more interest is being taken now in getting the academic forum widened for rehabilitation. Over the last few years, several meetings have taken place, conferences have taken place, and it is a continuity of the same, but with a wider agenda. MENA has sort of expanded from we used to do UAE, then we did the Middle East, and this is one that has gone a little bit wider to go Middle East and North Africa now. So we are bringing people in from wider area, and we hopefully will getting the message across to a wider region to develop the rehabilitation services. It is important for regional experts to get together and also interact with international experts, and this is what the forum MENA Physical Medicine and Rehabilitation Congress will provide a forum for that. The mingling of the two of the sorts, if you know, we can learn from the people from overseas, from international delegates, and the regional experts can share their knowledge both with the delegates who are attending the conference, also from the sort of speakers from overseas, so they can learn about our experiences. One thing that happens in the international arena, that a lot of people come over and deliver the lectures without the actual knowledge of the local region. And I think MENA conference will provide a specific forum where people will have both the regional speakers and a kind of little bit of helpings from overseas and the international speakers who will listen both ways, and they can learn about what we are doing, and we can learn about how they can begin to think differently in terms of the rehabilitation services in our part of the world. So if their messages are going wider, because a lot of people get invited to a lot of conferences and speak in the forums, so they're not delivering the message of Europe or America to our people, they're beginning to actually naturalize, if you may, the message which is more true to the patient population in our practice.
Thank you so much, Doctor, for your time.
Thank you.